This is 7 National News, and in our top story, Pakistan's Interior Minister, Rahman Malik, has stressed his country's appreciation towards investments from the UAE in all economic sectors, especially the telecom sector. According to Emirates news agency WAM, a local Pakistani newspaper said that while on a call with Chief Executive Officer of Etisalat Group, Ahmad Abdul Karim Julfa, Rahman Malik thanked the UAE authorities, particularly Etisalat, for doing excellent work in Pakistan. He said the people of Pakistan were benefiting from their hospitals and continued support for flood victims. According to the newspaper, Malik requested Ahmed Abdul Karim to enhance the telecom facilities for underprivileged areas in Pakistan, especially in FATA, Makand and Swat. Dubai Airport's conservation efforts are paying environmental and financial dividends as the organisation reported the results of its 2011 energy and fuel saving initiatives. The results reveal that the initiatives reduced CO2 emissions by 72,793 tonnes, saving 131.9 million gallons of water and achieved 15.9 million dirhams in fuel savings. Dubai Airports continues its aggressive campaign to conserve water and reduce power consumption across both of its airport properties. By installing energy-saving lamps and occupancy sensors, resetting air conditioning by a mere 3 degrees, and implementing chiller management systems, Dubai Airports managed to save over 21.4 million kilowatts per hour of electricity, worth 8.13 million dirhams. Dubai Airports will join other energy-conscious organisations across the world on March the 31st to mark Earth Hour by switching off all non-essential lights across Dubai's internationals, 3 terminals and at Dubai World Central. Drivers in the UAE will be able to use their credit cards in order to buy petrol for their cars. It's been 4 years since the UAE residents were able to use their credit cards in order to purchase petroleum due to the high transaction costs associated with the process. In response to requests by oil companies, the Ministry of Economy released a statement stating that the Supreme Committee for Consumer Protection approved the use of credit cards in purchasing petrol for an extra charge of 2 dirhams. This resolution overturns a decision made last year that prevents companies from imposing subcharges on consumer purchases. The decision aims to help decrease the losses the petroleum countries have faced during the recent years. It has not been yet announced when the decision will be implemented. Genetic research is on the rise in the Middle East as we see an increase in epigenetic diseases within the region, where research shows that 20% of Arabs have type 2 diabetes. Hereditary diseases in the Middle East are not uncommon, especially due to the prevalence of consanguineous marriages in the region, says Vice Provost for Research and Graduate Studies in the United Arab Emirates University, Professor Abdul Galadari. During a workshop on the responsible use of science and epigenetics held in Dubai Healthcare City, the future of research in the MENA region was discussed, and the importance of creating research talent pool in the Middle East was highlighted. The conference brought together international scientists from 16 different countries in order to help them collaborate and work through the challenges that scientists encounter in the Middle East, such as lack of funding and research infrastructure.
I think these kind of events are important because, importantly, they're gathering the regional scientists and scientific leaders, as well as the next generation scientists to be, as well as the young scientists, as well as the international colleagues, the expertise that are from abroad. And these events are bringing these people from abroad and the region, and they're being networked in this great environment, which is in Dubai. And we feel that these interactions will build friendships and networks that will then be continued after the event. There are, of course, also poster sessions where young scientists are presenting their work. And I think that would be a very good experience for our scientists because they'll be questioned by visitors and leaders in the field, and they will learn how to improve, how to focus on which areas and stuff like that. I think it's important as society develops that through meeting and through interactions, we can develop that much faster and more.
I think there's a lot of research that capabilities here. I think it's just building the infrastructure, making sure that the scientists get the right equipment, the right funding, the right positioning. And as you've heard in some of the discussions, I think we've built a lot of the infrastructures through our universities. A lot of the governments are paying attention to that. But I think the MENA region has to understand that science and technology is a growth engine. And that's how a lot of countries are viewing it. And that we have to invest and put the same amount of money that we invest in other parts of the industries or sectors.
In the developing world, only 54% of children under the age of 5 with pneumonia are taken to a qualified healthcare provider, leaving the remaining untreated and in need of medical assistance. Healthcare specialists in the region met at this year's Africa and Middle East Pneumococcal Disease Summit recently to address the burden of the disease, as well as the latest research practices, diagnosis, treatment and prevention methods available throughout Africa and the Middle East, including different forms of invasive and non-invasive diseases. Among them is pneumonia, also known as the forgotten killer, which is one of the leading vaccine-preventable causes of death in infants and children as young as 5. Dr. Sami Hussein Al-Hajjar stresses that a good surveillance program, which monitors emerging diseases, is vital.
In the Gulf country, the vaccine which prevent the most common serotype causing severe pneumonia actually was recently introduced into almost all the Gulf state. So the Gulf state already took the initiative, and the vaccine which prevent the 13 serotype of this bacteria which cause most cases of severe pneumonia and complication is now part of the national immunization program in this country.
Pneumococcal disease remains a significant burden both locally and regionally, and the panel stated that through the advancements made across government and healthcare providers in the region, opportunities to implement routine immunisation programs have been made possible.
Now, what's good about the vaccine is not only to prevent the severe infection, also it reduces children of carrying this organism. Now, for the future, after we introduce new vaccine, it's very important to have a good surveillance program. So, in order to be sure that the vaccine will continue to be effective, and at the same time to monitor whether non-vaccine serotype may emerge and start causing invasive disease or bad pneumonia.
And up next, by the day's business news, so stay with us.